Thank you so much and good afternoon. So indeed, I will present to you today an update on the preparedness activities for medicine shortages and especially the joint exercise EMA is undertaking with the European Commission, DG HERA, in order to be better prepared for this autumn and winter season in relation to antibiotics. So if we can move on to the next slide, please. As you may recall from the meeting in June, but also just a brief reminder that the Executive Steering Group on Shortages and Safety of Medicinal Products, so the MSSG, and also the HERA board in January of this year agreed that there is a need to prepare for the autumn and winter season of 2023 and 2024 to ensure that the shortages that occurred and the situation that occurred in this winter is not repeated. So in this respect, a joint EU-level exercise was initiated, which is aimed to identify any gaps between the supply and demand of a set of antibiotics used for respiratory infections so that we can understand if any shortfalls would be expected and if any EU-level actions need to be undertaken to ensure sufficient supply for patients. So the exercise is also important because it allows us to have a proactive approach to shortages, and also it serves as a basis for discussion with industry and also the member states on any follow-up actions. Next slide, please. So how these preparatory activities looked like, what have we done, and where are we now? So a subset of antibiotics that requires close monitoring for the autumn and winter season was agreed upon and identified by the SPOC Working Party and also the MSSG and the HERA board. We also thereafter identified the key suppliers for each active substance in scope of the exercise and collected the data on supply forecasts from those key companies. In parallel, we established demand scenarios based on historical consumption from the past years, and also we collected demand forecasts from the member states through EMA's POC Working Party for the autumn and winter season. We thereafter undertook the matching of supply and historical demand, and based on these findings of the matching, MSSG issued recommendations for proactive actions to be undertaken by all stakeholders to ensure better preparedness for the autumn and winter. During the summer, we also finalized the matching of supply with NSA demand, and we will present those findings to the MSSG and the HERA board in the upcoming meetings. Next slide, please. So the set of antibiotics to be monitored in the exercise was identified based on the intelligence on vulnerability of supply, based on shortages reported by EMA's POC Working Party in the past years, and also reflecting on the aspects of criticality from a therapeutical point of view, including the antibacterial spectrum. And based on the data that we collected throughout the exercise, the outcomes of the matching are available for the 8 antibiotics that you can see on the screen, and the outcomes also concern all pharmaceutical forms that are used to treat respiratory infections. Next slide, please. So what are the outcomes of the exercise? So firstly, of course, the outcomes are subject to a number of assumptions. Specifically, the first one, as we use the historical demand, we have to assume that the historical sales that we used and the data is suitable is a suitable proxy for demand. So what we also assume in the exercise is that all manufacturers will be able to fulfill their orders, that there will be no impact on the availability of APIs, there will be no issues with manufacturing or distribution. We also assume that there will be no new major events or public health emergencies, and also no new or more virulent strains of diseases that are relevant for the active substances in the exercise. Lastly, the outcomes are also subject to an assumption that the demand in the coming autumn and winter season will not exceed the average level of consumption in the past years. So the so-called intermediate scenario with nor the highest nor the lowest consumption. So with this in mind, we can conclude that the supply to the EU of majority of oral formulations of key first and second line antibiotics will meet the demand in the autumn and winter season of 2023 and 2024. However, the supply to the EU of some particular strengths of some intravenous antibiotics, as well as one strength of one oral liquid antibiotic, will not adequately meet the demand. Next slide, please. So based on these outcomes of the exercise, MSSG recommended to firstly increase the production capacity of the specific antibiotic pharmaceutical forms and strengths that were identified as of concern. Secondly, the MSSG also recommended for EMA and HERA to continue monitoring the supply and demand of the set of antibiotics and also to extend the monitoring to pediatric formulations of OTC medicines that are commonly used in autumn and winter, such as cough syrups, analgesics, and antipyretics. And lastly, the MSSG recommended to communicate to the public on these preparedness activities that are undertaken at EU level, and also to remind healthcare professionals of the prudent use of antibiotics and highlight the need for all involved stakeholders to avoid stockpiling. Next slide, please. So, considering the fact that the measures recommended by the MSSG aim to ensure sufficient supply to all patients, firstly, we do want to remind healthcare professionals of the prudent use of antibiotics and ask to order antibiotics and also pediatric analgesic, antipyretic medicines, and cough syrups as usual. Secondly, what we also want to ask patients and consumers is to only purchase the necessary amounts of antibiotics and also analgesics, antipyretics, and cough syrups for children, and only purchase when the treatment is required. We're also highlighting this specifically to you today as we also have some concerns already on stockpiling of these medicines that may be ongoing at pharmacy and patient level. And we want to reiterate that stockpiling medicines can put further strains on supplies and can worsen or even cause medicine shortages. Stockpiling has a major and direct impact on patients as it limits the availability of medicines to patients who need them. Next slide, please. So to conclude, we are undertaking proactive actions in line with the recommendations of the MSSG, and we are discussing with industry the possibilities to increase production of the medicinal products that were identified as of concern. We also continue to monitor the supply and demand in cooperation with marketing authorization holders and also industry associations. The supply situation in Europe is also being monitored through EMA's SPOC working party, and it is also monitored in cooperation with community and hospital pharmacists so that we can understand what is the situation on the ground. And lastly, of course, the exercise and these proactive actions allow us to be better prepared for the autumn and winter season. However, it is essential that all stakeholders cooperate closely. And here, healthcare professionals and patients have a key role to play in the prudent use of antibiotics and avoiding stockpiling. Thank you so much and happy to take any questions.